This meeting is being recorded.
Good evening. I'm Jay Brown, the Executive Assistant and a member of the Alaska Black Caucus. We are serving on the Health Committee, an organization that champions the lives of Black people in the areas of health, economics, justice, and education. Thank you for joining us for tonight's community conversation, community recovery, personal stories of loss, and recovery from COVID-19. Please remember that this conversation is being recorded for rebroadcast, so please keep yourselves on mute. If you have questions, use the chat and we will try our best to get to them after all our panelists provide some introductory information. Please welcome tonight's moderator, Reverend Dr. Patricia Wilson-Cohn, who will introduce our panelists. Thank you.
Thank you so very much, Ms. J. Brown, and good evening, good evening, good evening. The special thanks goes out always to Mrs. Celeste Hodge Groudon, the founder and director of the Alaska Black Caucus, and her awesome team with the Alaska Black Caucus. If you have not joined, please join. It is a good place to be, a good place for learning, and we're so blessed and thankful that we still have the opportunity to meet here on Sunday evenings for one good hour, 7 p.m. to 8 p.m. to share and dialogue about these interesting community conversations. Tonight with us on the panel, and I'll have Ms. Deanne Woodward to introduce herself to you. We also have supposed to be showing up Dr. Philip Mendoza, but if not, then of course I'm going to introduce myself at the end as the panel moderator. So we'll now hear from Ms. Deanne Woodward.
Good evening, everyone. Thank you for having me here and allowing me to join in the conversation this evening. I am currently serving as the Associate Vice Provost for Targeted Programs and Populations at the University of Alaska Anchorage. I am also co-founder of Wilderness Adventures for Kids Everywhere Incorporated. It is our nonprofit that serves youth in K through 12, and we provide mentorship throughout the academic year, summer camp experiences in the summers, and scholarship opportunities for students when they're graduating from high school. And that's based here in Alaska. I just want to say that I'm enjoying my time working with the caucus and serving as the program manager for the COVID-19 grant funding. So excited to be here. Thank you. And I look forward to sharing my story and experiences around COVID for my fiance, as well as my side of it as a caregiver.
All right. Thank you so much, Ms. Woodward. And did Dr. Philip Mendoza, was he able to join us at all yet? Nope. Okay. Well, I'm Reverend Dr. Patricia Wilson-Cohn. I'm a womanist theologian out here in the great Alaska. I'm the pastor of First American Baptist Church. I'm also an association clinical pastoral educator, certified educator, which merely means that I teach and educate chaplains, clergy persons, lay persons in the ministry, the importance of doing hospital ministry, the importance of meeting people where they are and not where we want them to be. And I'm the founder of Cohn's Spiritual Counseling Center, licensed out here in the state of Alaska, retired Lieutenant Colonel Chaplain from the United States Army Chaplaincy Corps. So I have a heart for our veterans out here doing pastoral counseling with them, and a heart for the BIPOC community doing pastoral counseling with them. So for starters, we're just going to go ahead with Ms. Woodward, and she's going to first share a very important story in her relationship to COVID-19 and her fiance. Please hear her. We're so thankful again for Ms. J being our executive assistant of Alaska Black Caucus and here tonight to help us out. And we're also thankful for Ms. Allison Hurrigan. She will be monitoring the chat this evening. So community persons that are joining us, feel free to put any questions or concerns in the chat, and Allison will chime in to share those with us. Okay, Ms. Woodward, please.
All right, thank you so much. First, let me start by saying that I live and work on the land of the Dena'ina people here in Alaska. I want to take a moment to acknowledge that. And then I also want to acknowledge and pause to recognize that all of us have had experience with COVID in some capacity, whether it was because we became ill ourselves, someone we know or love is close to us had to fight with this disease during this pandemic. And if you've been one of the blessed ones and lucky ones who have not experienced COVID firsthand, you've been impacted by the domino effect of a pandemic hitting our world, not just our nation, but our world and our state. So you've had to wear a mask, you've not been allowed to go to functions, you've seen all manner of restrictions placed as we try to battle this pandemic, which is the first for most of us in this era to experience something like this firsthand. So I do want to acknowledge that my story is just that. It's my story and it's my fiance's story. It may not be yours, but I do know, talking with other folks, many people have experienced this story. So my fiance, Sean Jordan, got COVID back in March of 2020. So this was when it was first hitting the US broadly. It was before we knew very much about it. He is retired lieutenant colonel. He was traveling at that time. He was still in active duty, and he was traveling, stationed at the Pentagon, back and forth to Europe from, I guess, maybe around October of 2019 through the time that he returned in March after his last trip to England. He had been to Germany, to England, several places. He was gone probably 3 weeks out of every month and traveling constantly. Never get sick, ever, never get sick. And suddenly headaches, feeling bad, all of the initial symptoms, losing taste and smell, fever 104, there by himself. I was not able to travel to him as we suspected. He definitely seemed like he had COVID. By the time they tested him, there was no such thing at that time of the rapid test. So he had to wait. And it was over a week before he got test results back. In that time, he got progressively more and more sick. He could not keep anything down. He could not breathe. He could not even climb the stairs to go to his bedroom to be able to go in his bathroom and shower even. So days had gone by before he ever could get even a shower because he was there alone. At one point he'd gotten so sick and they called in medicine for him, but they wouldn't deliver it. So he had to drive 45 minutes to Fort Belvoir. For those of you who don't know, Fort Belvoir is there in Alexandria, Virginia, just outside of Washington, D.C. As I mentioned, he was stationed at the Pentagon, but he had to drive himself 45 minutes to get to the hospital where he would pick up his prescriptions. When he got there, of course, they were not letting people in the hospital, so there was a line outside. The young lady took one look at him, saw that he did not look right, ran a test really quickly to see what his oxygen level was. His oxygen level was below 80%. She could not believe that he had even been able to drive himself to the hospital, had him parked. He came with nothing. He didn't have a charger other than in the car. He didn't have a bag. He didn't know he was going to be admitted. They admitted him immediately. That began a horrific journey. He spent 10 days in ICU, praying that they would not intubate him because we already were hearing that people who were being intubated were dying. And it was a scary thing because he was in this room, and this is a military hospital. As I mentioned, he's a lieutenant colonel, so he's a senior officer. He's been in the military over 30 years, and no one would come in the room with him. They talked to him through a glass window. These are healthcare professionals who have studied all their lives to be able to provide services for the sick. When they did enter the room, they were in full hazmat gear. They did not clean his room. They did not offer him a gown. They did not offer him anything to freshen himself up with. No towels, no washcloths, no soap, no anything. Remember, he was not planning to be there, so he didn't have a bag. And no one could bring him a bag because they wouldn't let anyone bring anything into the hospital. So about the 6th day, I was FaceTiming with him and got the nurse on the line and asked, can someone please give him some baby wipes, something so he can wash his face. And remember, he's been having fever every day. So he's sweating. He's in the original clothes he came there in. and just miserable. Of course, you're miserable. And they didn't clean the bathroom. He could barely get to the bathroom, but when he did go, they wouldn't come in and clean it. So days go by. The toilet is not, nobody would want to sit on that toilet, and just his overall treatment, his experience in there, the way they spoke to him, the way they spoke to me, the implications that I was one of many that might be called to check on him, one of many females, because I wasn't his wife. I was his fiance. And so will a different DM, would it be calling tomorrow? A nurse actually said that to us. And when I tell you just this every single day, it was a struggle. Nurses not checking the records. So he's having to answer and he can barely talk. Every question, every shift change because they don't read the chart. Just too afraid, called him on his cell phone. The phone in the room wasn't working, so they're calling him on his cell phone, telling him to pick up his cell phone, but he doesn't have a charger. So we're worried he's not gonna, when the phone dies, how am I gonna be able to communicate with him? Did not read his records. He has sleep apnea. He requires a CPAP machine. So for those that don't know what that is, that means when you sleep, you stop breathing. And usually it's matched with excessive snoring. So that snoring is sometimes what will wake you up, but it will cause you to stop breathing. So he coded 4 different times and they thought he had died or they were waiting for him to die. And turns out just before they were about to intubate him, a respiratory therapist just asked the question, did anyone ask this guy if he has sleep apnea? And just by chance, did they discover that that's what it was? He wasn't stopping breathing because of the COVID. It was the sleep apnea. So I tell this story because it took him to finally get into, I guess maybe around the 7th or 8th day, he got into combat mode. His PTSD was through the roof. He didn't trust anyone in the hospital. There were several misdiagnoses. And his system was shutting down. His liver was not functioning properly. He was urinating and defecating blood. His skin was gray. He's very dark skinned, but his skin was ashen. It was gray. And he could not walk to the bathroom. He couldn't breathe. He sat in a chair the entire 10 days. He would not lay down flat. And that's probably the only thing that saved his life is because he stayed prone. And he fought hard. And he brought attention to all of the disparities that were going on in their hospital. And he would tell them, if you're treating me like this as a senior officer, what about the service members who are first airmen, privates, who don't have any clout, who don't have anyone to speak for them? And he asked to speak with the hospital administrator, told his story, then went on and reported, because nothing was being done, reported it up the chain into the US Surgeon General's office. And only then did they send down a 1-star general via helicopter to come in and meet with him. And this young lady was a former doctor who worked when the AIDS pandemic epidemic first erupted and had to work with AIDS patients. So she had to put on all the gear, but she came in the room and sat down and just talked to him to find out his story. And she said, sir, I'm so glad that you shared your story because this is happening not only in military hospitals. That's why she was there to fix the problem, but they didn't have anyone who would speak up and tell the story. She says, this is going to help us to make some changes, but this is happening in the public sector as well. And it's happening too often that our patients of color are not being cared for in a manner that is consistent with their needs or as a priority. And so I wanted to share that he was able to get that story told up the chain and help them to begin having those dialogues around how do we make systematic change that is going to be felt by our patients of color, where they begin to feel valued and their healthcare is not just brushed aside. I can pause there. The second half of my story centers around the long COVID and how long has taken him to recover. So I'm happy to pause there, though, if there are any comments or questions in the chat or shared stories.
Thank you so much, Mrs. Woodard. And you know, she says some very important perks here tonight, audience. She listened, she cared, she was an advocate for her fiance. Those are key words. Storytelling and story listening are parts of the survival of any community, but definitely BIPOC community. So, Ms. Woodard, could you say more about what you learned from the experience and how did it change you and the work you've been called to do today?
Thank you. Yes. Well, for me, it helped me to realize even more how important it is for everyone to have someone, if it's a friend, if it's a neighbor, if it's a loved one, someone close to you who knows your story when you have to seek care, particularly when you have to be admitted to a hospital, especially in these times around the pandemic when you are not always allowed to have someone go with you to the hospital. It's important to have those people's names and contact information communicated to the healthcare providers who are there, the nurses, the doctors, and give consent for your health to be discussed with that person. And then they need to clearly advocate for you, ask the questions, pay attention, watch their face. If you can FaceTime with them if you can't be in the room. Ask them to charge to their phones. You know, they can do that for a patient. That's not a big deal if they don't have them. Ask what kind of care package can be brought to the hospital to support your loved one or your friend or whoever you are helping that's going through this process. I learned that if we don't speak up, they will do anything. And not trying to suggest that all healthcare is bad by any means. I've had some good experiences, but I've also had some shady ones between the birth of my 5 children. Every experience was a little different. And when you have to be, and I had high risk pregnancies, so having to be in the hospital for a little longer, you experience different things. But as it relates to COVID, I highly recommend one that we not sleep on it. We don't think we're out of the woods because we're not. COVID's not going anywhere. We don't necessarily, if CDC is showing and we're getting closer and closer to herd immunity where it's beginning to act more like the flu did before the flu vaccine came out, that's fine. We're moving in that direction, but don't fall asleep on it because it mutates and you just never know. So continue to be hyper vigilant, ask your questions, be supportive, talk to your loved ones, and pay attention to the signs if anything is amiss, especially if they are in the hospital and something doesn't sound right. Don't be afraid to speak up and ask questions and demand answers.
That is very important. Community tonight, ask questions. Most of us grew up with this adage that no question is a dumb question. No question is too large. No question is too small. We must use the gift of the voice and ask pertinent questions. And you've heard me say this on this forum before. Please, please, if you have not formulated and signed a living will, please, this is the time to do it. Everybody, in my teaching, in my pastoral counseling, I emphasize, do you have a living will? What is a living will? You can get it from your medical doctors in your various communities. You can go to the local hospitals and ask for a copy of a living will. It's like an advanced directive, actually, where you will sign it and you will indicate, do you want to be on life support? Do you not want to be on life support? Do you want to be fed, intravenously is basically what you're answering. If you become brain dead, and in the BIPOC community, many of us still say things like, oh, God is going to take care of me. Please mute yourselves if you're not talking. I'm hearing a little something in the background. I don't. So yes, we in the BIPOC community, we go to God or the higher power in our lives and we say, oh, I know God is going to heal, God is going to take care of me. As a pastor, as an ordained clergywoman, I certainly have faith that God still is a miracle working God in all of our lives, but God also works in the doctor's team, the medical team, and we need to take seriously the importance of signing the advanced directives or the living will, whichever it is called, so that loved ones will know what to do when we become sick, when we can't make decisions for our own lives. This is not something we should want the family to have to decide. It's all of our responsibilities to decide what's good for our lives. Do it for your children. You know, when they're born, we have these lovely celebrations. We have birthday parties, but nobody says, you know, my child is 12, 15, 10. It's time to talk to them about, do they want to be cremated or do they want to have a big funeral in a church in a casket? These are real life situations. COVID, people are still dying. Loved ones are still being hospitalized. It is our responsibility to use our voice, to face reality, and to do something about it. Thank you again for sharing with us. And another question, how does the lack of cultural competency and cultural humility impacts the care given to the BIPOC community? This is very important. Ms. Woodard, do you have something? And I don't know if the doctor is joining us or not, but Ms. Woodard, you're doing a great job, so help us with that, please.
Thank you. Yes, I think that's very true. Something as simple as in one of our earlier community conversations, the presenter, he's a medical student, he talked about how the medical community trains the upcoming professionals, doctors, nurses, etc. And he gave an example of a traditional way of identifying a particular illness or disease was based on the colors. If the skin turns blue in certain areas, you would be able to tell that this person has whatever that disease was that they were using in the example. And he said that he raised his hand. He was the only Black student in the class, and he's very dark skinned. And he raised his hand. He said, "So how would I tell that on a Black person whose skin, whose melanin is dark? So, and how would we tell we can't see blue on a person with dark skin?" And the doctor, the instructor, his faculty had no answer for him. He said, "That's a good point. I guess we have to try to find another way to identify this disease." And it is glaring how in medical education, in nursing, healthcare in general, oftentimes those types of things are not even considered because of the history of medicine. And it was never designed to address medical needs of the BIPOC community. It was designed, and the father of much of the modern medicine, it was all designed to how to better serve our Caucasian brethren. And so with that in mind, it's no wonder that there can be a lack of cultural competency amongst healthcare professionals. They just simply haven't been trained in many cases. They don't know what they don't know sometimes. But I think it is incumbent upon them as medical professionals and supporting the BIPOC community to make themselves as aware as possible, to understand that no, Black women don't have a higher tolerance of pain. We feel pain in very much the same way as any other human being. And as with any other human being, some people, regardless of their culture or race, feel pain differently. I have a daughter who has extremely high tolerance of pain. And I have one that if she just nicked her finger, you think it just about got cut off. So it just depends on the person, not the cultural background.
Yes, I resonate with you. And, you know, as you're going to the doctors, and we know COVID is still on the rise in the country, let's be sensitive to not being shamed when we go to the doctors or our medical professionals to talk about our health. Pain is a part of of survival. Some of us have low pain tolerance. Some of us have high pain tolerance. But it's nothing to be ashamed about to go to your doctor and say, you know, I've got a pain here, or my face is breaking out, or my armpit, something is going on with my body, and to talk about that. You know, Brene Brown is the great licensed social worker today, writing all these wonderful books about, you know, shame and Atlas of the Heart. I think she's had a something on HBO Max this week. And, you know, she emphasizes the importance, people, that shame is what, you know, something is wrong with me. You know, guilt, I must have done something. And then vulnerability, one of the latest words that we've been using. Vulnerability, my friends, is not that you and I are weak. Vulnerability is courage. You're using your courage to give voice to what's going on with your mind, your body, your soul, your spirit. Um, do what you feel is healthy for you. I still have on my mask at church. I had to preach today, and I'm up there and I unmask when it's time for me to get up and say something, and I mask back up. You know, regardless of what the system and the country is saying, it's your health. What are you comfortable with when it comes to contracting COVID? What are you comfortable with in our still COVID community? It's only one of you. We live in a community, but Naim Akbar, a great African-American psychiatrist in Tallahassee, Florida, says we need one another, and we do. We need to come together like we have this forum tonight to talk about our health, to still have an honest and open conversation about COVID. So please have a voice. Pay attention, as Ms. Woodard has said, when loved ones are being hospitalized with COVID. Try your best to FaceTime. You know, if you don't have a little iPad or laptop, you know, try to get a phone. And maybe this is a way the community can help. If someone came to my church or just saw me in the community, you know, saying, Pastor, my loved one is in the hospital, I don't even have a phone. If we can come together to do some basic things in the BIPOC community to help connect with the loved one with COVID, that may be our calling during these unprecedented times. We've got to learn the importance of sticking together, not going against one another, but coming together saying, what can we as a community do to help this woman or this man or this human being with their loved one who's in the hospital in our communities, so that they will have some way to connect. So Ms. Woodard shared how she paid attention to what her fiance was saying. She listened to him. She FaceTimed him. She talked about, was an advocate for him getting a phone. She said we could share care packages or whatever. We could be the care providers. You know, in the hospital today, you know, a lot of immediate family members are the only ones there admitting, and it's that one immediate family member still. And they want to know, one of the questions, I have a member in the hospital as we speak, and they were saying, okay, you are who and what are you doing here? And I'm like, I'm her pastor. And, you know, her sister took the initiative to make sure my name was in the record, you know, is understood that I'm going to stop by if it's only 15 minutes to pray with this person, to talk to them, to give hope. And people want to tell their stories. We from the BIPOC community, we have survived today, audience, from storytelling and from story listening. We are oral, traditional people, and we know it's our stories that has empowered and enlightened us to get where we are today, and we need to continue with that. So I do understand. I don't know if we have anything in the chat. Miss Allison Corrigan, do we have anything in the chat that we need to give some attention to now?
Yeah, I'll share a couple of comments from the chat. So Celeste had written that her dad, who is 88 years old, didn't have COVID, or but received similar care as Deanne was describing when he was admitted. She was constantly advocating for him, and her dad eventually asked to stop out of fear that this would cause him even more harm. So wanted to share that experience. And then we also had a comment here that Alaska Legislative Rep Vance has a bill drafted that would allow patients to have a personal representative present in the hospital to serve in that role as an advocate for their loved one. And I can absolutely appreciate the value in that, and wanted to draw attention.
Yes. Thank you so much, Allison. So continue sending some information to the chat, and we'll pause for Allison to share that with us as we continue. Ms. Woodard, you said you had another story that you would like to share with us, please.
Yes, this is the long COVID story, if you will. There's so many patients, so many people that whether they had mild symptoms or really severe symptoms, it's the story that's hardest to capture because some of the symptoms may or may not be able to be linked directly to COVID because there's still so much we're learning. But what I witnessed was a solid 18 months after first contracting COVID. It took that long before he could really walk for any length of time without breathing hard. He's still, and it's been 2 years, over 2 years now, going upstairs and long walks are challenging, hard to breathe, having to catch breath, and we have so many underlying conditions just oftentimes in the BIPOC community that are hereditary, that just with COVID, those things could be exacerbated, and continue to see a lot of other things that he suffered with, from his heart being a little enlarged, and problems with the liver, problems with the rectal and urinary blood in the urine and in when defecating. So, those kinds of things just take a long time to overcome. And we hear so many stories about people who maybe, they weren't struggling as much initially, but over time, they began to see that disease really did attack many organs. It attacks the brain, it attacks the heart, the lungs, the liver, the kidneys. It just really ravages through the body. And sometimes we don't see the symptoms right away, and sometimes it's down the road. But it's important to note that we still have to pay attention to those symptoms. We have to go to the doctor when we have them, especially if you had COVID. It's important to point out anything that doesn't feel right, that you should be aware of your own body and what your body is telling you. It will give you signs. So you have to listen to them and seek out medical professional help. Go to the doctor, tell them what's going on, tell them you had COVID at some point, if you did, and have those discussions so that you can really get a handle on what may be going on with your body. Your doctors cannot help you if you just make the assumption, well, it'll pass, it'll be okay. Don't wait. In the BIPOC community, we have a really bad habit of not going to the doctor when we feel ill or something's wrong, and we have to break that cycle of not going. Oftentimes, many things can be prevented or at least mitigated if we would go to the doctor early enough. And if you're at the point where it's so bad that you barely can get to the doctor, it may be too late. So I just want to encourage everyone that, pay attention. Long COVID is real. It is not a brand new thing. If you're suddenly having trouble with something that you didn't have pre-COVID, but you had COVID and something popped up, go have it looked at. And it doesn't matter how small it is or how minor you might think it is, it's best to get it diagnosed and on the books, because it could progress, and you want to make sure that you document it from the first time that you're experiencing it, so that your healthcare provider can work with you to find a solution and help you through that issue, whatever that might be.
Yes, indeed, Ms. Woodard. Go to the doctor. We can't overemphasize that tonight, community. Please, men, get your checkups. Colon cancer is real. Breast cancer is real for men and for women. So get your checkups, your annual checkups. So if something is going wrong, she mentioned that her fiance had some heart challenges for the long term. some liver challenges, urinary area, how it attacked his organs, you know, his brain, his lungs. It's important that we know our bodies. And again, that word shame. Don't be ashamed to tell your partner, your wife, your husband, the human relationship that you're in. Please have a trusting relationship to share with them. This is what's going on with me. And we know Celeste was going back and forth to take care of her father. I'm sure he had to share stories with his daughter. Perhaps he didn't want to share. I mean, with my own grandfather who had cancer, colon cancer, and I didn't even know it until years later. But, you know, I could tell he was ashamed to come and share with his granddaughter, you know, what was going on with him and that part of his body. But it's important that we build these relationships where we can trust each other enough to be vulnerable again, to share the story and to put the shame aside and say, wait a minute, I need help. There's a poem that I use in its title, We Need One Another. When we would come to die, we would want someone to hold our hands. We need one another. When it's time to celebrate, we want someone to hold our hands and celebrate with us. We need one another. When it's time to be sick, you know, Ecclesiastes tells us, the 3rd chapter, there's a time for everything. We're going to be sick some days. You know, every day is not our best day. So how do we hold up our heads and say, I'm not feeling well today. I got this headache, or something going on with my heart, or there's a pain in my side or my back, so that the one that you confide in, the one that you love, the one that you have this trusting relationship with of intimacy and love and understanding, they can help be an advocate for you, driving you to the doctor's office, helping to take care of you. You know, the theme tonight is really looking at recovery, personal stories of recovery, and loss from COVID. There are all kinds of losses in our lives, and we have all kinds of stories with this COVID experience. It's a loss just talking about it and realizing we've had losses in the community, losses on our jobs, losses in the church from loved ones with COVID. A family member is missing. They're not the same. But how do we embrace them? How do we love them? How do we meet them where they are with their stories? And listen, listen, listen. People are hungry for someone to listen to them. And people are hungry for someone or some place to tell the story. So know your body. She emphasized the importance of the signs that occur in the body. Be aware of that. Listen to your body and tell the doctor your story. When you go to that doctor, if they say, oh, we checked everything and you are okay, it's your body. And I call it personal authority. You have the personal authority to say, doc, something is wrong here. Is there another doctor in the house for me to see? You've got to be adamant about your body. You know your body better than anybody else out here tonight. Ms. Woodard, I see you have unmiked yourself. What else do you care to share with us, please?
Yes, I just wanted to add on to what you were saying about advocating for yourself. My mom and my dad are 88 years old as well. And they go to their doctor and they listen to their doctors, but they've had more than a few occasions when surgery or something really extreme was recommended for them to have done for something that we weren't convinced it needed to be surgery. And their first inclination was whatever the doctor says, that's what we need to do, because in our community, we are taught that, you know, they are the experts. And we had to help them to understand that they are entitled. And matter of fact, it is in their best interest to get second opinions if anybody says they need to cut on you or have surgery, because it is a very serious decision. And the older you are, and then sometimes with the culture that you are from and what underlying conditions you may have, you have to think long and hard and find out and advocate for yourself. Again, I say that again, to see if there is another alternative to surgery because it is so extreme, especially when they get older. My dad adopted the habit of telling anyone who would listen, his brothers, his sisters, all seniors, and he would tell them, look, these doctors, well, they call it practicing medicine for a reason. They are human, they are not perfect, they don't know everything. So it would be in your best interest to recognize that they are practicing and you need a second opinion on anything that's major or significant, even if it's just for good measure, even if it's just to see if you get the two same diagnoses or whatever the case may be, but making sure that you do listen and you communicate and you ask questions and do your homework, research it for yourself. And if you don't have a way, or if it's someone who's elderly or a senior who may not be able to really research this stuff for their own, because they just don't understand, help someone, encourage them to talk to their granddaughter or grandson or to their child or to a friend or someone at the church, their pastor perhaps, or someone else in the community that they work with. Tell them what they said. Don't be afraid and don't be ashamed. As you said earlier, just ask questions. You've got to do your own research and you have to speak for yourself.
So very true, very true. You are so right. And when you said something about, ask your pastor, I have my congregation, we're a small group of people. And one of my mottos is we're a little piece of leather, but we're well put together, because I've got persons as old as 92 in the church. And then I got a youth department and they're like in middle school. But every Sunday I make it a point to go to my elders in the church. How you doing? How was this week? I want to know, did they keep their doctor's appointment? One lady, she has to go be on dialysis 3 or 4 times a week. How was dialysis this week? If I hear them lifting up particular prayer concerns about their body and their health, or if a loved one has COVID, or I want to know, did you take your booster shot yet? How you been feeling? And this is one of the things we can do in the spiritual community, not just meet and preach and teach, and all the clergy here doing that great work that God has called us to do, but we've got to be more intentional with our congregations and congregants and parishioners to really seek, how are you doing? Are you taking your medicine? Do you have a care provider? All of these are good preventive measures to help the BIPOC community. So thank you for lifting that up. I certainly want to talk a little bit about our children and losses and their stories. Ms. Woodard, do you have anything, pertaining to what is in place for children after COVID in terms of their recovery? For example, children who lost parents or who had to stay home without support of education. So what needs to be in place for our children? And then I'll speak to it from a spiritual perspective as well.
Thank you. Yeah, the stories are endless of young people who have lost their loved ones, whether it was a parent, a sibling, an uncle, an aunt, a friend, even in some cases. And I don't think anybody really knew how to support the level of grief that our communities experience, and in particular children. The children are not equipped to deal with it in general, in my opinion, because it is such a concept and such loss and such hurt, and they are still learning how to express themselves with everyday emotions, let alone the trauma of losing someone they love to death. And I know there are some communities in some areas that have paid attention to the youth and provided support services, whether it was through their schools or through a church or through a community group or big brothers and big sisters and other similar programs, YWCA, YMCA, try to take those things into consideration where they can. But how do you truly support a child in the midst of a pandemic that they can't even go to school? I'll use Anchorage School District, for example. When working with them through our early college programs, we would be in the classrooms, in the schools every day with students. And if there was something going on with a student, they felt suicidal, they were depressed, their demeanor changed, their behavior changed, multiple people could witness that from teachers, that as we get to know our students, right, we recognize if someone's having a bad day or if it's extending longer. We see these signs, right? But that's when they are in school. The pandemic hit and everyone was working from home, going to the classes from home, and teachers didn't see their students like that. It's harder to pick up on those kind of cues on a video screen. And so while the numbers in the district seem to go down for suicide referrals or concerns around that, giving a false sense that things were better during the pandemic. No, what we discovered in talking with counselors and in talking with teachers and faculty at the college was that it wasn't that the numbers went down, they in fact went up.
Excuse me, Ms. Woodard. Ms. Woodard, I'm sorry to interrupt, but please mute yourselves. We can't hear Ms. Woodard speaking with other mics unmuted. We would appreciate your help.
Thank you. Thank you. But you know, it wasn't a matter of those numbers going down so much as they just weren't being reported now because teachers and counselors aren't seeing the effects. We know that children had to be home during the pandemic. So not only did they suffer with loss in some cases of a loved one to COVID, but some were placed in situations where they had to deal with domestic violence or food insecurity or isolation, or a household where there were, you know, 4 kids and 2 adults that all have to use one computer because that's all they have in the house. And if they have that, and if they have a stable internet connection, but still being held accountable for their education, it has been traumatic on our youth and on our children through this pandemic, whether it is that they lost someone to COVID or they just had to go through all of the isolation. You know, it was interesting. We were having a conversation with some seniors who were graduating last year. They were seniors from last year. They didn't get to have a prom. They didn't get to have homecoming. They didn't get to experience all of the things that they've gone through school to get to that senior year and have all those wonderful senior experiences because of COVID. And it makes you recognize that there's a whole generation of young people who are going to be formed and their perspectives impressed upon because of their experiences with this pandemic. And it will change the shape of our future in so many ways. And, you know, I think about the babies that were born during the pandemic who have never known the world without COVID in it. So all of these things play into how we as a community should be seeking to support our youth. I just don't feel like we do enough, but I think it's important to have the conversation so that we can discover what groups are doing something. And if they're not enough, then what more can we do?
Absolutely. That is good information, community, tonight. And a little more I wish to share regarding our children and death and dying, especially of parents that died of COVID. You've got to tell the children the truth, because you don't want them thinking, oh, I did something, that's why mommy or daddy died. They left me because I was bad or I did something wrong. So tell the children the truth about death and dying. If you need to talk to a pastoral counselor or take them to therapy to get you some guidance and help, do that. You want children to be able to talk about their feelings. Help them to name, I feel sad. I feel lonely, alone. I'm angry. God took mommy. Why would God do that? So the child grows up with this, you know, just incongruent experience of God and the love for the child. So tell the truth that mommy got sick. We took mommy or daddy or the loved one to the hospital and they died. They're not going to come and be here with you, but I'm going to be with you, or grandparents or aunties or uncles. You know, we'll be here for you to help you continue to grow up and make it through school, and let them talk about those feelings. They've got to get the feelings out of them and to help them to name what's going on inside of them. And a lot of parents say, oh, I'm not going to take my child to the funeral. Well, research in grief and counseling has shared this with us. At least talk to the child and perhaps give an example that if you go to the funeral, you're going to see mom, dad, or sister, or brother, or loved one in this lovely box. They're going to be dressed up. The funeral director is going to have them looking all pretty. And this will be a way for you to say goodbye to mommy, daddy, or the loved one that has been with us in this family and has helped you. You're going to give them, you're going to prep them for it. And if you can't do that work, because it's nowhere in writing that says you have to be the qualified one to do it. That's why God has created pastoral counselors, social workers, psychiatrists, and therapists to help us with this part of loss. Because loss is real, people. And we as a BIPOC community, we must become honest and open when it comes to death and dying of loved ones. So let's continue to figure out how to tell the truth to our children, how to help them name their feelings, how to help them to release that the loved one didn't die because the child did something wrong, but creative ways of setting each other free in healthy and holistic and human ways for that child to continue to survive. I know we're about 7 minutes out of time. So I want to check to see if Allison Harrigan has anything else in the chat that we perhaps need to look at tonight with Ms. Dionne Woodard and myself here tonight in sharing with all of you this community recovery. Again, thank you, Ms. Woodard, for sharing your personal story about yourself and about your fiance. Thank you so much. And thank you, community, for joining in with chatting regarding recovery and loss from COVID. Thank you for being attentive to us tonight. Thank you, Ms. J. Brown. Can't say thank you enough to Mrs. Celeste Hodge Grouden, and even for sharing the experience of your father who didn't have COVID, but you certainly took the responsibility to travel back and forth and to let the community know. So figure out if you need to leave the state of Alaska to be with a loved one, to do the best you can, do that. All we have is one life to live on this earth. And I tell everybody, live it to the fullest. You just got one life to live. Let's live in love. Let's live in harmony. Let's live in peace. I was talking to a friend earlier. Let's, as BIPOC community, let's look at our jealousy. Feeling like the person that God or a higher light or power has given you to love, and you're so afraid that someone is going to take that person from you that you don't focus on the good of the relationship that you have with the person. Let's look at envy in the relationships, that you're just envious of Miss Woodard because how she wear her hair, how she wear her makeup. She hasn't done a thing to you, but you're just envious and going to say negative things about her or these other beautiful women and men of color on the screen tonight. And then there's greed, trying to scoop the good out of a person for your good without realizing there's enough to go around. I believe in God, so if God can give it to me, I know God can give you and give you more. But do you need to work for it? Yes. Do you need to take responsibility? Yes. Do you need to do your part? Yes. And as a community of people, we all experience loss differently, but loss is real. So how can we continue to come together in these types of forums to talk about COVID, to talk about the losses, but to give each other some hope and some understanding? So Allison and Jay, what do y'all have to say before we close, as we're closing out tonight?
Yeah. Oh, thank you so much. It's just such a pleasure to be here and to thank you for sharing your stories. I wanted to share a study actually that just came out yesterday. This was a study of about 2,000 adults in the UK who were hospitalized with COVID-19, and the researchers followed up with them 5 months and a year after they were discharged from the hospital. The patients in this study reported kind of self-reported symptoms, and then they also measured their physical performance and organ function. And so, kind of speaking to Deanne's point and what's been shared tonight about taking away shame when you're talking about this and not having stigma around what you're experiencing, there's 10 common symptoms that were persistent in about 2/3 of people 1 year after being discharged from the hospital for COVID-19. And these included things like fatigue, muscle ache, poor sleep, breathlessness, joint pain and swelling, slow thinking, short-term memory loss, and limb weakness. And so I just wanted to say that these things are common, unfortunately. Currently, we don't have specific therapies for these symptoms. There's a lot of folks working on it. But just wanted to say that we still know that the vaccine is the most highly effective way to protect against severe illness, including hospitalization. And so just wanting to put a plug in there for that. And again, thank you so much, Deanne, for sharing your fiance's story. And thank you to everyone for being here tonight.
Amen. Thank you so much, Ms. Allison Hurrigan. Jay, you have some closing words, or does Mrs. Celeste Hodge-Groudon have any other words or sharing for us tonight before we close out?
I believe that is all the comments that we have for tonight. Again, thank you to our program participants and of course for you joining us this evening. We also want to thank our caucus members and Allies for Change group for their continuous support. If you'd like to join our great organization or link to the Allies for Change group within the Alaska Black Caucus, please visit the alaskablackcaucus.com. We would like to thank the Municipality of Anchorage. This program was supported by a grant awarded by the Municipality of Anchorage, Anchorage Health Department. The opinions, findings, and conclusions or recommendations expressed in this publication, program, and exhibition are those of the authors and do not necessarily reflect the views of the Municipality of Anchorage, Anchorage Health Department. Additionally, the views and opinions expressed by participants are their own and do not represent the institutions or organizations they're associated with in a professional or personal capacity unless clearly stated. Be sure to join us here next Sunday for a community conversation, No Place for Hate, a conversation with Anchorage young people. Until next time, good night, everyone.